Hello, everyone. My name is Alicia Jackson. I'm a licensed professional counselor, and we are still on this journey of learning about ADHD. And I thank you guys so much for your willingness to kind of lean in and talk about this. This is it's like a big thing. It's a big thing, so I appreciate it. Today we're going to talk about treatment for ADHD and what that looks like. So we did talk about it in briefly about ADHD and the recommended treatment for it, which is medication and therapy. Okay, so that's why the initial screening is so important. The initial screening and the psychological evaluation is so important because medication is for the most part a part of the treatment. It's not always a part of the treatment, and I'll give you some more background about that. Just how we talk about autism being on a spectrum. Now, there's children who have a hard time giving eye contact or nonverbal. And then there are children who have no issues giving eye contact, or it might be uncomfortable, but they still do it. And they're able to talk with you just like any other person would. And they are also on the spectrum of autism. The same is for an individual with ADHD. There is a spectrum within ADHD diagnosis as well. Some individuals can utilize the structure and the strategies provided in therapy and be able to pretty much manage their life for the most part without the aid of medication. That is not always the case, but it is possible. Okay, so medication is needed, and I can explain to you the function of medication for an individual with ADHD. There's two types of medications that are prescribed for an individual with ADHD. It is a stimulant and non-stimulant, and there's multiple reasons why psychiatrists would prescribe a stimulant versus a non-stimulant. I don't want to get into too much of that because that can be a lot of information to take in, and I am speaking from, again, my experience in working with individuals with ADHD. And so a lot of times, just in short, there may be more things going on with the person. We'll just say, even if they have a physical health, so say if they have a history of heart disease, taking a stimulant it doesn't just stimulate like one thing, like, oh, I'm going to just stimulate the part of the brain that is dealing with ADHD. It's going to stimulate all of it. And so that's a part of the heart rate. So if there's history of heart disease, that could be very dangerous to someone who has that. And so that's why non-stimulants are also an option. But what we talked about last week was that how ADHD affects the brain, and that there's a lot of areas where it's not functioning properly. And so taking a stimulant will help to stimulate that part of the brain which is not functioning properly, and it kind of helps that individual to stop and think when they wouldn't normally do that. It would help them kind of clear the brain fog. That is a lot of what I hear clients say and experience when taking the medication. It's like, oh, it's clear up there. I don't have to work so hard. A lot of times children or even adults experience a lot of headaches because of the amount of work they're trying to overdo because of the dysfunction. That's their executive dysfunction that they're experiencing. And so having that medication makes it just easier. Now, unfortunately, most stimulants are they're time limited. They only work for about 6 to 8 hours, and so they typically do it so that it can help you through your work day or your school day. And then they might give, depending on what's happening with the individual, they might give them like a little dose to take when they get home to help with homework and things of that nature. But medication can be very, very useful for individuals with ADHD and help them just not have to work as hard as their brain is working to do work that people who don't have ADHD can just do naturally. So also therapy. Therapy is very, very essential. Medication alone only does so much. It only does so much. And it also kind of teaches the person or child that it's the fix. And it's not necessarily so. Okay. So therapy can help a lot of those different areas that we talked about, help the child or person learn ways to, one, like be mindful, pay more attention to themselves, their feelings, their emotions, and also find healthy ways to manage them on a regular basis. Be more aware of their emotions, be more mindful of their emotions, but also find healthy ways to manage and cope with them. Oftentimes, children who, especially adolescents, who are experiencing very high, just think about they have impulse control issues, and their emotions are up and down, up and down, up and down. They are going to maybe not make the best decision or judgment calls when it comes to how to manage their emotions, and put themselves in pretty dangerous situations. And so therapy and a therapist can be very instrumental with helping them build the tools necessary to work with their emotions, build the tools necessary for them to find strategies on how to structure their day, structure their time, structure how they remember things that they forget, how to balance those things and build those things through their life, and make it to where they're managing their ADHD, and their ADHD isn't just something that they feel like is something they have to live with, or that has them, but they're taking an active role, they're taking an active seat in managing their own ADHD. Okay? So yes, therapy can be a very, very important tool in this how we do treat ADHD, and again, also medication is a part of it. It's not always a part of it, and it doesn't have to be a part of it, but it is recommended. And I understand people's apprehension about medication. It is still something that's pretty stigmatizing in our community, so I don't take that lightly. And at the same time, I use this example a lot. If someone has type 1 diabetes, their body does not know how to deal with insulin, right? Doesn't know how to process it. So they have to use an insulin pump. No one looks at them or judges them because they have to do it. It's just part of what they have to do to take care of themselves. Well, the same for someone who has ADHD. They have to take this medication so that their mind and their mind is able to regulate itself better so that they can show up for themselves and feel more competent. A lot of times what happens truthfully is when ADHD is not diagnosed or not recognized, a child or an adult feels like they're inadequate, and they're always looking at others to figure out, like, what's going on? Why is everything easier for everybody else? Everybody else can organize and plan their lives. I'm always feeling stuck. Why was school such a hard thing for me when it wasn't for my peers? Because they are functioning, unfortunately, without all the knowledge about how their brain operates. And so then they tend to come to believe some pretty negative things about themselves, which are inaccurate. So definitely know that treatment is possible and is necessary. And I hope that this helps to give you some better understanding about it. Thank you guys again so much for watching. And of course, feel free to comment below and ask any questions, and share this video with anyone that you feel would benefit from it. And you already know, subscribe to my channel. Everybody's doing it. No, I'm just kidding. I don't want to peer pressure. I'm not that person. But please, subscribe to my channel. And as we close up this series on ADHD, got a good video for you next week. Take care.